we're joined by Joy Phumaphi, co-chair of the Independent Accountability Panel. She's joining us from Botswana and is going to talk about her experience at the UN on high-level panels that address global health crises and current experience on an accountability panel. So, Joy, thanks for joining us. In your experience as part of the UNSG's high-level panel on global health and crisis, what's important in strengthening national and international health systems right now and for the future?
Well, when we submitted our report at the beginning of 2016 to the UN Secretary General, we underscored the importance of national health system strengthening. And we said it has to start with implementing the core international health regulation core capacities to ensure that there is proper surveillance, proper laboratory capacity, and proper human resource capacities in all the countries to deal with the pandemic, and to ensure that the health systems are strong enough in order to be able to detect a new disease, communicable disease, as soon as it occurs. But in addition, we underscore the importance of a strong health workforce. And for Africa, that does not just mean nurses and doctors and lab technicians, etc., but it also means community health workers, trained community health workers who will be able to ensure that the women, children, and adolescents have access to all the health services that they require. And most importantly, in a pandemic, these community health workers will be able to educate the people about how to protect themselves. So the strengthening of community engagement was a very important part. And we also said that as a last resort, it is important to always have military pre-trained for health and humanitarian crisis missions. So you pre-train them. You don't wait until there's a crisis, then you say, we need the military, and the military does not know how to handle people. Because we're having cases right now in different parts of the world where the military is ill-treating people because they've not been pre-trained to handle how to deal with people in a humanitarian crisis. We also underscored in our report the importance of gender aspects of health crisis. As we can see now during the COVID-19 pandemic, there is an extensive levels of abuse of women, and particularly intimate partner violence has skyrocketed. And these are the gender aspects of health crisis, which you need to prepare for in advance, so that when you institute lockdowns like this, you have proper services in place that are going to support women and children who find themselves in these circumstances. Internationally, we recommended that ODA should be strategically directed to an incremental on-budget 5-year plan for health system strengthening.
I think some of the shortcomings are obvious. And, do you see some of the positives? Some countries that were more prepared than they were in 2016?
I think there is a level of preparedness. I mean, those countries that were dealing with the Ebola crisis in 2014, 2015, countries like Nigeria that used the army of polio workers to actually educate people about Ebola and to spread the Ebola message and to prepare communities. There was actually a big difference in a country like Nigeria in their ability to be able to handle Ebola, and they know the effectiveness of deploying an effective community health workforce when in a health crisis like this. So these were successes, but these successes occurred during the Ebola crisis, and it would have been good if there was an emulation in other countries. Countries like Ethiopia, for example, have increased tremendously the number of community health workers that they have out there in the field. So because they have these community health workers, if they are properly trained on how to respond to a pandemic of this nature, they will probably be able to handle it much better than those countries that are not ready. But when it comes to readiness in terms of IHR core capacities compliance, those countries, of course, that have been able to strengthen core capacities will stand a better chance. But we all know how dire this particular pandemic is, and that even strong health systems in some of the developed economies have been overwhelmed by the cases and the excess morbidity and mortality.
Yeah, it's a challenge everywhere for sure. So, moving on, what's the strength of the WHO and the UN during an international crisis like this? Can you, say where you think that that these bodies are very important?
I think after the Ebola crisis, or let me say during the Ebola crisis, WHO established a more robust program for outbreaks and emergency management than the one that they'd had before. But what the panel had recommended, and I still feel if this recommendation had been implemented, we would be seeing a better response now to COVID-19, was that hand in hand with this established program, which is the Center for Emergency Preparedness and Response globally, there must be command and control authority. So that if, for example, the time when the first cases were detected in China, if China had allowed WHO to come in, and this is the command and control authority that we're talking about, that WHO does not have at the moment, but we insisted at the time as a panel that this authority has to be given to WHO, because this will be special circumstances, so that in these special circumstances, WHO can go in and verify for itself. Maybe we'll be speaking about a different thing right now, but WHO has not been given that command and control authority. And because it does not have that command and control authority, and every country is very, very protective of its own sovereignty, we are left in a situation like this where we could not send in global experts into China to be able to verify and to be able to share with us the dangers of this pandemic. I also feel this pandemic is showing more vividly than before the need to integrate health and humanitarian crisis trigger systems. There is a slight improvement on the trigger mechanisms, but they are still not good enough. The time when that it took before a global emergency was declared by WHO was far too long. And this is because of the trigger mechanisms that are in place. Now, these trigger mechanisms have to be reviewed. And I feel that this is one of the major lessons that we have learned from this particular incident. But another lesson has been that we called for a strengthening of the capacity of WHO. And we know that this did not happen, and that WHO went into this fight with very, very limited capacity to be able to handle it. So another lesson that we are learning now from COVID-19 is that WHO must be ready at all times. And it is our role as the global community, as members of the WHO and the UN, to strengthen the capacity of WHO and make sure that it is ready before the next global crisis.
So what I'm hearing is you're saying there needs to be more of an empowerment of these bodies and a strengthening than sort of a disempowerment and moving them from the equation.
Absolutely.
As the independent accountability co-chair, what's the importance of accountability for commitments that governments are making now and for continuing to deliver for women and children and adolescents, as they had already committed to?
Accountability is about people. And I feel this global pandemic is demonstrating this to us more than any other lesson that we could possibly learn as a human family. It reminds us that the relevance and impact of carrying out a commitment that you make, whether you're a government, whether you're in a civil society, whether you're a technical partner, whatever role you have to play as a stakeholder in health, must be measured by outcomes for people. That is the outcomes for women, for children, for adolescents. The reason why we are in such a crisis is because the well-being, the health, the lives of these women, of these children, of these adolescents have been threatened. Now, what we must remember is that COVID-19 is not the only threat that is facing these women, these children, these adolescents. There are children who still need to be immunized because we don't want outbreaks of measles that are going to kill the children. It makes no sense to save the children or to save the women from COVID-19 and then allow them to die from malaria, allow the children to die from pneumonia, allow them to die from preventable, non-communicable diseases, chronic illnesses like diabetes, high blood pressure, or even diarrheal diseases, which becomes very common once governments or service providers take their eyes off the ball. So the services that we have been providing for family planning services that we have been providing for women, children, and adolescents have to continue. We have to find new ways of delivering the service. We know, for example, that the traditional immunization campaigns cannot work, but we must find a way of immunizing the children, even if it means that an immunization campaign which would previously have taken maybe 3 weeks now takes 6 weeks. For example, because if you are now immunizing smaller cohorts and you now have to take smaller groups because you have to observe the social distances, you have to equip the nurses, you have to train them on how to immunize now within this pandemic, this crisis situation. But we have to find a way to continue to deliver those services. I mean, countries like Benin, for example, some countries in West Africa have come up with a way of delivering mosquito nets, the same way the newspaper boy, in developed countries who deliver a newspaper, you just throw it onto the porch. So they'll throw the mosquito net onto the porch with directions on how to hang it up and how to use it. So this shows true commitment to continue to make sure that the service is provided to communities. Now, these services must be provided. We have to find a way of doing it. And that is the big challenge that is facing us. We must also find a way of making sure that women do not shy away from going to health facilities to deliver because they are scared of being infected with COVID-19. So we have to find a way of making them confident as they go into a health facility, for example, that there is a checkpoint on the site where maybe a tent, it could be a tent, we're talking about developing economies, a tent where the temperature is taken, and if you have got any of the symptoms of COVID-19, you are taken aside and you are properly checked, and hopefully rapid diagnosis tests are made available. Because it is important for everybody to know their status. So we have to make sure that we avail these tests globally to the developing world. We don't just manufacture the tests for the developed economies alone. So if we have a system like that, where people are screened and women can feel confident that when they go into the facility, they'll be safe, they'll be protected, and that they're not going to get a COVID-19, then they'll continue to use the services for delivery. So the guidelines that need to come out from WHO, from the governments, on how the response of health facilities, of the health sector, of health service providers during the times of COVID-19 cannot be just guidelines that deal with a COVID-19 case alone. There have to be guidelines which tell you, how do I continue to provide the routine services to the people without endangering myself and without endangering the community, so that we don't have people dying from malaria and other diarrheal diseases like we had during the time of Ebola. The number of children who died from malaria, diarrheal disease, pneumonia were much, much more than those that died from Ebola. And there is a danger that this will happen again if we are not careful and if we do not learn from that experience. And if we do not provide the right type of guidance right now to the health service providers in communities.
Great. Yeah, what I'm hearing from you is that commitment on a local and international level to continue delivering health services and then also preventing the spread of COVID-19. So do those guidelines already exist from the Ebola crisis that can be picked up again, and put into action?
We are encouraging guidelines to be prepared. I mean, there are guidelines that have been produced for immunization, but and I think they are good guidelines, except for the element where they are advocating for the suspension of immunization campaign. Like I said earlier, I feel that you should still find a way of conducting the campaigns without gathering a lot of people together in one place. But in a lot of our communities, immunization campaigns are the only way that children are immunized. So that saying that we should go to routine immunization where the routine immunization service has not been provided in some senses is unrealistic. So we have to find a way of making the immunization campaign safe. Recently, I think a day or so ago, WHO shared guidelines with countries on how to continue to deliver malaria services. And there are guidelines on how to continue to deliver TB services. So I feel that we need to have these guidelines for every type of service so that we do know that the standard way of delivering services will not work because it relies heavily on person-to-person contact and person-to-person contact between patients and between patients and the service and the healthcare worker. So we have to find a way of delivering these services without that person-to-person contact between patients particularly, but also limited contact between the client if they are not sick or the patient and the health service provider. So my strong plea is that we need to develop these guidelines and develop them urgently where they are not yet available.
Great. Joy, you have very clear thinking about many of these issues. How are you specifically working on COVID-19 right now?
Well, normally I work in two areas. I work as a champion, supporting the champions against malaria. So we have been working very closely with the RBM partnership with the WHO to work on these guidelines that have just been produced that I talked about earlier, but also encouraging countries not to stop malaria campaigns. And we have also been very, very proactive. Over a month ago, we wrote to the IMF, to the World Bank, a group of us, asking them to do what is currently happening now. That is some element of debt forgiveness, particularly waiving the interest on loans, and so that countries are not required to pay back loans at a time when they are seriously burdened. As of Finance of Africa, actually this year, if the interest is waived, that will save $40 billion US dollars for African countries. That's a lot of money that they could use to fight, in the fight against COVID-19. So we try to be proactive, and as the IAP, we are working on a 2020 report that will be delivered in July at the high-level political forum that is focusing on the nexus between COVID-19 and women and children and adolescent health. And we try to underscore the issues that I have been speaking to today about the importance of focusing on people. Because if you focus on people rather than just focusing on the disease, then you focus on protecting the people, then you protect the people from every disease, not just COVID-19. COVID-19 is extremely important, but we mustn't let people die from other preventable causes while we are protecting them from COVID-19. So that is what our report will be focusing on this year. And we are going to focus on equity, the equity issue, so that the people who are furthest left behind, the disadvantaged communities, they are the ones who are likely to suffer most from the old causes of ill health as well as from COVID-19. And this has been clearly demonstrated, I think, in the case of New York recently. And we expect this to be sort of replicated around the globe, where there are a lot of communities that are resources that the middle class has. So we are underscoring this, and we are hoping that releasing this report in the middle of this year will also help to catalyze effort in trying to protect women, children, and adolescents so that they don't become unintentional victims of COVID-19, even without suffering from COVID-19.
That'll be a really important report, and as guidance and somewhat of a reflection on what's been happening. So thank you very much for your time, and we'll look to you as the situation develops for updates.
Thank you so much, and thanks for the interview.